question that we are frequently being asked is how long will it take to get better? So I would like to use this diagram to explain the journey that a patient will go through when they come to our clinic. We tend to split this journey into 3 stages. The first stage is recovering, the second stage is healing, and the third stage is wellness. I would like to concentrate on the recovering stage this time. When people come to us, they usually tend to come on this point where they are in pain, they are symptomatic, they might not be able to do certain activities in their life, and they approach us. So our aim to begin with is to change the pattern how the body works, to convert the body from being injured into healing, and in order to do that we need to start with the more frequent appointments, which are these dots. Sometimes people will feel better from the word go. As soon as you start with the first few appointments, they start to feel better. Sometimes it might take a little while before they start feeling better, and some patients will even feel a bit of tenderness before they start getting better. The main aim is to get to the point that the body is changed the pattern and start the process of healing. The second stage in their journey tends to be the healing. This is where a patient is get to the point that they feel so much better and they can do more, they are less in pain, and they are less concerned about the complaint overall. So they tend to be here. At this point, what we tend to do is, judging by the patient, is to space these appointments. So the appointments will be much more spaced out, allowing the body to heal and allow the actual physical time for everything to settle down and get used to the new pattern that we have introduced. Sometimes on this journey, patient may decide that it's not the right thing for them and they decide to leave. The risk in it is that some of them will tend to relapse, and we will need to introduce again a more frequent regime in order to bring them back to an asymptomatic manner. But majority of them do continue with us and continue feeling better and better. The third stage is the wellness. This is when people get here. At this point, they tend to be 100%. Some of them might even forget why they came to us in the first place. We always recommend, even when you are feeling better, the reason why you didn't feel as good when you first came to us is because you didn't take care of your spine. We always recommend to maintain some sort of ongoing appointments, keeping on top of any concerns that the patient may have, and generally the patients enjoy the chiropractic so much, feel so much better afterwards, that they choose to stay with us. So I hope that understanding the 3 stages will give you more overview of what you should expect when you come to us. We start a bit more frequent, we reduce the frequency, and then we give the patients an option to actually maintain chiropractic as a way of life.